I wanted to circle back to one thing that you were talking about with the dental, vision, and hearing on the Advantage plan. So, like, I'm sure Ty and Alice can relate here, but we get a lot of questions during annual enrollment because people are seeing all the television commercials that are talking about certain plans, but really all they key in on is the dental, vision, and hearing benefits, these added benefits. So what I'm hearing you say is there's a major trade-off when you go with an Advantage plan with that dental, vision, and hearing versus the supplement that has more comprehensive medical coverage. Do you have any? So if somebody is calling us during annual enrollment and they're seeing all these commercials and they're on a Medicare supplement right at that moment, can you just talk to that type of person and what you would say to them, whether it's a good idea to switch to an Advantage plan for those benefits?
Yeah, that's a great question. And like I said before, we get that call quite often during the open enrollment. And typically the call goes something like this. Hey, Suzanne, I'm on a Medicare supplement. I'm seeing these ads on TV for the free dental, free vision, free hearing. Does my plan have that? Or what can you tell me? And I kind of go back through just what we just talked about is the Medicare Advantage plans, they're trading off the medical coverage. So what is important to you as the consumer? Are you willing to pay more per month to have more comprehensive coverage and then just buy a dental and vision plan separately? Or are you the kind of person that says, you know what, I'm willing to take my risk. I'm willing to assume a higher potential liability, and I'm willing to stay in the network because I want these extra added benefits of the dental, the vision, and the hearing. And I clearly explain that to you because you're going from they're completely two different type of policies, two different type of plans. Let me give you this analogy. And most of you probably, we've done this when we had our initial conversation. So think of a ladder. So think of your ladder. I'm a visual person. You guys all know that. So think of your ladder. At the top of a ladder would be your Medicare supplemental insurance, because really you can't get more comprehensive than a supplemental insurance. So at the top of the ladder is your supplemental insurance. Down the ladder would be a Medicare Advantage plan. Now, let me explain why. Because a Medicare Advantage plan being down the ladder means that you are assuming a higher liability for your medical coverage. So when you are just turning 65 or you're just going on Medicare for the first time, you have the choice to pick a Medicare supplement or Medicare Advantage, regardless of your health. But let's say, for example, that you go with a Medicare supplement here at the top. And as you age, let's say at 75 years old, because we all know that unfortunately premiums go up as you age. Let's say at 75 years old, you say, hey, Suzanne, I'm just not so sure I can afford the Medicare supplement anymore. Can I move down to a Medicare Advantage? Because now I don't have the income to pay my premiums, and now I'm willing to accept a higher liability. So here's what we can do. During the open enrollment period, you can always move down to a Medicare Advantage plan, regardless of your health. Okay. But let's say, for example, that you start with a Medicare Advantage plan. So remember the ladder, supplements up here, Medicare Advantage is here. Let's say you start with the Medicare Advantage, and 2 years from now, you call me up and you say, hey, my doctor just said that I need my hip replaced. I want to move up to a Medicare supplement. If you've been on that Medicare Advantage plan longer than 12 months from your Part A effective date, then you have to medically qualify to climb up that ladder to a Medicare supplement. So this is exactly the explanation that I give people when they call me at open enrollment and say, should I move from a Medicare supplement to Medicare Advantage, or should I move from Medicare Advantage to Medicare supplement? What's the rules? That's exactly my explanation. So those are great questions.